RTT News, live from the CES in Las Vegas.
Healthcare and technology are converging at the Digital Health Summit. Jonathan Linkous of the American Telemedicine Association joins me now to discuss what the future holds for technology and healthcare. Thank you so much for joining me.
Thank you very much. It's really a pleasure to be here.
So what are you seeing here at CES right now?
Well, there is just the innovations are amazing of what's happening right now in terms of the use of technology to help healthcare. It's anything from helping you just get along better in your home, wellness applications to things that can be used in a hospital. It's a whole array of activities right now.
This is now a multi-billion-dollar industry that people are spending on to find ways to improve their health without having to go to the doctor. What are we seeing along those lines?
Well, there's a lot of applications right now that are really aimed at having people do better in their own homes. So that's really the most exciting part. Anything that can help you in terms of tracking your exercise, helping to lose weight, helping to stop smoking, certain things like that, or people who have chronic diseases, like people who have diabetes, people who have a chronic heart failure. Those are the type of things that cost healthcare millions and millions of dollars. Cost the taxpayers, all the payers of healthcare, millions of dollars. And yet these applications that are things like remote monitoring, where you can keep track yourself of some of these applications, can help you take better control of your own health care and also really save a lot of money.
Now let's talk about this twofold. You mentioned the stop smoking, exercise more. These things have been around for a little while, treadmills, things like that. What are we seeing in more personal health as opposed to diseases?
Yeah, well, for example, there's an effort by one of the exhibitors here, Continua, which is an industry alliance, to link up all these different types of exercise and wellness devices so that they all have a data port. And once they have a data port, all of a sudden there's all sorts of interesting information that you can get out of there. So not only are you using a pedometer to measure your walk every day, but you're finding out how long you've walked, how far you've walked, how many steps you've taken, and compare that to everybody else in your age group on a daily basis. You link that into your scale, so you can also compare that to what your weight is like. And you can link that into all sorts of other devices, like taking your blood pressure, taking the blood oxygen levels. There's all sorts of things. Link them all together, and all of a sudden you have your own electronic health record that you can really take on a very direct way, and it can help you, a very, very easy step, 1, 2, 3, to go through any type of an effort you want to take, with getting in better shape, losing weight, again, stopping smoking, any of these types of things can really make a tremendous difference in the way people really handle their own lives.
And on the flip side of things, handling the lives for those with the chronic diseases like diabetes, you mentioned that we're going to save millions and billions of dollars once this gets up and going.
Absolutely, and it is really going right now. It's really starting to go. And it's not only just with the individual, but even health providers are prescribing these. You're seeing your doctor on a regular basis for diabetes, and we all know that taking your blood count and your glucose levels on a regular basis is really important. But what happens if you do that on a constant level, and it's a data that comes out, and not only are you reading it, but it's going into a monitoring center, and so they can notify you, hey, all of a sudden, hey, wait a minute, something going on here, you need to pay attention to it. That's the beauty of what's going on right now in healthcare.
Absolutely. We can have the doctors help but not go to the doctor all the time.
Absolutely. And it also saves them time as well. I mean, right now we have an increasing shortage of doctors, especially of specialists. And any type of thing that can help lighten that load and extend their reach to other patients that maybe they couldn't get to before really makes a difference in terms of healthcare.
Saving time, money, and being healthy, I can't think of anything better.
That's actually right.
Right. Thank you so much for meeting with me today.
My pleasure. Thank you.
Stay logged on to RTT News as we continue to report live from the floor of the CES. I'm Deborah Ruther.